Okay, so 3, 2, 1.
Good evening and welcome to this webinar that we're running in relation to vaccinations for children aged 12 to 15. I'm really delighted to welcome you here to listen to our speakers. My name's Chris Munday. I am the Executive Director for Children and Family Services here in Barnet. And I'm really interested in hearing from parents around these issues and talking to you about the concerns and benefits of the vaccination. I'm also a parent of 3 teenagers, so I'm also going through a number of the debates in my own head and with my family and with my children about vaccination at this present time. I'm delighted to first of all welcome Tamara, who's going to talk for a few minutes, and then I'll be introducing Sarah, and she's also going to talk for a few minutes. We'll then open up for questions. If you can type questions into the Q&A box, we will endeavour to answer those, and Marianne, who's on the call, will be reading those questions out for us. So first of all, a really warm welcome to Tamara, who's the Director of Public Health here in Barnet. Over to you, Tamara.
Thank you, Chris, and good evening, everyone. Really great to see so many of you here. So what I was going to do is maybe start by just talking very briefly where we are with the pandemic in the country and in Barnet in particular, and then talk about 12 to 15 years vaccination and the background why we're doing this. And then I'll give you a personal perspective too. And I'll hand over to Sarah to talk about logistics of the vaccination, risk factors, and risks and benefits, and then we'll go to questions. So where we are as of today, we see a different rates in the country, but overall the rates of the infections are slightly decreasing. What we have is about 300 per 100,000 in England rate. In Barnet we have about 255 per 100,000, which is slightly higher than the average London, which is about 180 to 100,000. What we see is a slight increase in school-age children, and we have about 40% of our current infection in school-age children. We also are seeing maybe a slightly higher infection rate in more deprived areas. That has been a trend since the beginning of the pandemic, and these are also the areas where we have the lowest vaccination uptake. So these are the areas of concern, but at this moment in time, we only see potentially in every ward, we see about 10% of people having infection. In more deprived areas, we see about 12 to 13%. So it's not significantly higher, but it is slightly higher than the rest of the borough. So as you know, we are moving to a phase 4 of the pandemic, which is really us all learning how to live with COVID and try to rebuild our lives as much as we possibly can. And certainly as one of the major things that we think we've seen a huge impact on is education for our children and young people. And also what we're seeing is impact of a pandemic and lockdown is certainly mental health and well-being, and then wider issues such as unemployment and so on and so forth. So we all have been touched by this pandemic in one or the other way. And what we do know is that we definitely want to try to live as normal as possible and live with COVID, not live in fear, but live with the awareness that this infection and this virus is going to stay with us for a very, very long time, and we need to protect ourselves and get on with life, if you like. So as you know, 4 chief medical officers of the UK have written to our health minister at the beginning of September, advising health minister to introduce a vaccination, universal vaccination for 12 to 15 year old children. So what was recommended before is the vaccination for 12 to 15-year-olds who were clinically extremely vulnerable, and those who had underlying condition, and also those who lived with in household where someone is immunocompromised. So there's been lots of conversation and discussion in media, press about how this decision was derived at, and you might know that joint vaccination and immunization on the 3rd of September looked at all the evidence at that point in time, just looked at the clinical benefits, and on the basis of clinical benefits, they statement, if you like, was that at this moment in time we probably wouldn't go to universal vaccination. But they also recommended to chief medical officers to look at the wider benefits. So what chief medical officers have done is talk to Society of Royal College of Pediatricians, Royal College of General Practitioners, psychiatrists, educational experts, looked at all the risks and benefits and impact of the disruption on education and not being in face-to-face education, as well as clinical benefits, and have recommended vaccination for 12 to 15-year-olds. What we do know is that when JCVI have looked at the evidence, they looked at the 2 doses of the vaccination, and we have seen in press, and we have learned that a second dose of vaccination in these children potentially linked to myocarditis. Sarah will talk more about that. So therefore, our chief medical officers recommend 1 dose of vaccination Pfizer at this moment in time, while gathering and learning from the evidence across the world. We are lucky in a way that USA, Canada, and Israel have already started this program some time ago. So there is lots of emerging evidence from those countries, and we are carefully monitoring this, but it's unlikely that the second dose will be recommended before spring. And I have also 3 children. One is actually not a child on a paper, but 2 are 16-year-old twins. And about, I don't know, 2 months ago, when the invitations came, I said to them, knowing everything I know, and being a director of public health, I said, let's see, give a couple of weeks to see how others are doing. And they said, Mom, we can't believe you're saying that when you actually constantly, we can hear you talking about asking everyone to get vaccinated. And I think that I'm sharing this personally because it's that dilemma of public health benefits, health benefits for the whole population versus your own children or individuals, if you like. They pushed me to it, and they are both vaccinated. They had a sore arm for one day. They were quite quiet for one day, which I enjoyed, and they're absolutely fine. So on that note, I'll hand over to Sarah to give a bit more details about the vaccination program itself.
Lovely. Thank you very much, Tamara, and thank you everyone for joining us this evening. So I'm going to keep this brief because I'm keen to see what questions are coming through and make sure we answer those, but wanted to give you a few details on what we're organising in Barnet. And I say we're, but actually it's NHS partners, and we're just facilitating this. So it's a whole group response, but the NHS is certainly leading on this. So as Tamara says, it's 1 dose of vaccine that is recommended for our 12 to 15-year-olds, and that would be a dose of the Pfizer vaccine for this age group. I'll come on to risks in a moment, but that was because the Pfizer vaccine has the best risk profile for these young people, and that's really important. There are some 12 to 15-year-olds who would be offered a second dose, like Tamara says, if they live in a household with someone immunocompromised or have underlying health conditions themselves. But what I'm talking about here is the majority of our 12 to 15-year-olds who'll have 1 dose. So vaccination started today in Barnet, so this webinar is very timely. They've been to the first school today from our school age immunisation service in the NHS, and their colleagues with the clinical commissioning group. So that's our primary care colleagues who visited a school today. It's an injection to the upper arm, and that leads on nicely to some of the side effects. So a lot of the side effects are local, so you can get a heavy arm, you can have some pain in that arm, as you'd expect from having an injection in your arm, to be honest, and that's pretty short-lived. And that's the kind of side effect that's more common. You might also feel tired, feel achy, get a headache. Again, these are short-lived, mild side effects. As with any medicine, there are risks, and that's, I'm sure, one of the questions that I think I can see is already coming through. And I'd like to sort of be upfront and clear with you that there are risks, as with any medicine, but those have been looked at in comparison to the benefits, and those health benefits for an individual child do outweigh these risks, because the risk of anything more serious than feeling a bit achy are rare. So there is talk often in the press around something called myocarditis or pericarditis. That's essentially inflammation around the heart, either in the heart or around it. That's a rare side effect. It can happen, and we know that because we have seen some potential cases in the US and Canada, so we've got that wealth of data to draw on. But in most cases, if those young people get treated, fairly simple treatment, after a few days, they're completely fine. So it's something for us to have on our radar and be aware of, and there is a risk there, but it's not so much of a risk to outweigh the health benefits of not getting COVID, which comes with a whole wealth of risks itself, obviously. I think I might leave it there, because I'm keen that we get onto the questions. So hopefully that's a little bit about what we're doing and some of the risks that we're aware of, and we can perhaps answer further questions if you've got them more specifically.
I think, Marianne, you're going to start with the questions for us. So
yes.
Should we start with the first one?
Okay, first question. Can you explain why and how we decide to have one jab for the teens while other countries opt for two?
I can take this one. I think what we're saying in this country is looking at the careful evidence and potential risk of myocarditis, although it's mild. We're seeing that risk of myocarditis goes up with a second dose of a vaccine, and therefore only one dose is recommended at this moment in time until further evidence is gathered across the world. One Pfizer vaccine gives about protection about 85 to 90%, depending on the immune response of an individual, and therefore is deemed to be actually sufficient at this age. But we, as I say, are looking into the evidence, and we may well come up with a recommendation for the second dose in a very near future.
Thanks, Tamara. Next question, please, Marianne.
Would the teenagers vaccinated be given vaccine passports?
To come in here, I don't think this has been clearly clarified firmly as yet. My understanding and my expectation would be that this would be recorded through the NHS app, as it is for anyone else, and that process would be the same, because this is an NHS service being delivered by NHS vaccination teams. But I don't believe that's been fully confirmed, but that would be my expectation.
Thanks, Sarah. Next question, please, Marianne.
So I have a question here asking, is it safe to give both vaccinations at the same time? I'm assuming that refers to COVID-19 and flu, because both vaccines are in place for young people during the season. So
Sarah?
I'm happy to come in here. Yes, so it is definitely safe for both to be given at once. As you may or may not be aware, the flu vaccine programme is being expanded this year all the way up to year 11, so there's quite a big increase in that this year. It's safe to give them both together. In fact, it's ideal in that it doesn't disrupt education as much if they're both given on the same day. That's true for almost all vaccines with the COVID vaccine. The only one that we advise a gap is for shingles vaccine, where we advise a week, but that shouldn't be appropriate to this age group anyway.
I just wanted to come in on Chris that we have started offering a booster and a flu, not in young people, but certainly in age groups, in risk groups 1 to 9. And we had the vaccination board meeting today, and reports back are that it's very acceptable by the public, and at least 20 to 30% of people have received both, depending on obviously on availability.
Thanks, Tamara. Next question, please, Marianne.
What side effects of vaccination are likely to impact 12 to 15-year-olds?
So I think this is probably what I've just mentioned, to be honest. Yeah. It's the sore arm, headache, feeling a bit sort of bluey that you might get for a day or so is what we would expect more commonly.
Okay.
Next one, Marianne.
Yep. If the virus usually has mild effects in 12 to 15-year-olds, why is there a need to vaccinate them? Is the risk of the vaccine greater than the virus?
Shall I come in? So there are a couple of things here to be communicated, I suppose. The first of all is in most cases it is a mild illness. However, there are very few rare cases when illness can be severe, and unfortunately we have recorded also some deaths in this age group as well. And also when you have a COVID infection, you don't know what proportion of people would go on to have a long COVID and complications as well. It's definitely less common in younger children, but it still does happen in younger children. So vaccination on that sense is much more beneficial than not vaccinating or having a COVID. And JCVI have concluded that certainly the benefits are marginally higher than the risks anyway. But there is also something about I've tried to convey earlier is the public health benefits and the wider benefits of this vaccination program. What we're trying to do here is really minimize disruption to education, minimize disruption to face-to-face. So although infection is mild, people or children who would have a COVID illness would have to stay at home and would have to miss school for a minimum of 10 days. That's why also we have reduced number of people who have to self-isolate, as you, I think, I'm sure are aware. So on the basis of that and on the basis of looking at a huge mental health impact on children and young people across the country because of a lockdown and online education, having all of these things considered, it's recommended for the population health benefits and provide the mental health and well-being benefits to have vaccination administered.
Thanks, Tamara. Can we have the next question, please, Marianne?
Yeah. Is the school or are schools getting any form of incentive or extra funds for allowing this vaccination program to happen on site, or even vice versa? Are they being penalised for not permitting this to happen on site?
I'm not aware of any incentives or penalties for schools participating in this programme.
No, so just to add to this, COVID-19 school immunisation programme is not the first school immunisation programme, and schools are very aware and very used to do this. National guidelines expect schools to provide school sites and provide information of children who are eligible for vaccination for any school vaccination programmes. And school always cooperate, and in Barnet we have not seen anyone who does not cooperate. If there are specific issues, we will certainly support school to introduce vaccination program, but there absolutely are no penalties if anyone completely does not want to do that. But we have not in any other immunization school programs have had any issues so far of schools not cooperating. I just saw one other question. I just wanted to, and it's very practical question. Is asking who is public health. So public health team is sitting in the council. Some of us are medically qualified, some of us are not. But we also work very closely with the NHS, with our CCG colleagues as well. And in terms of the vaccination program, we have at least 2 or 3 meetings a week to organize. And we also, our role is really to support the NHS to deliver program locally, but also because council and Chris's team lead on supporting schools, we kind of work as a conduit between the NHS and the schools. To broker the relationship, but also to support with any guidance that people might need.
Thanks, Tamara. Marianne, the next question, please.
If we are still gathering information, what is the urgency for getting the first dose?
I'm happy to come in. So I think the urgency is that COVID is out there. We could always wait to get more data and more information, but in the meantime, people are being infected with COVID, and that's a very real risk that we know already exists. So that's the balance. I think the UK have brought in their vaccination programme for young people after other countries, so they have waited to see what is happening. Millions of doses have been delivered in the US, Canada, and Israel. So we have that information to draw on, but we don't want to wait so long that in the meantime everyone gets COVID and potentially has consequences of long COVID. And as with everything, it's a balance. And I think that's why we've ended up here.
Okay, and a sort of follow on to that is what is the reason to have the vaccine if a child's already had COVID and has natural immunity, which is very strong?
So I think one thing about this is we are still learning about duration of immunity, partly because COVID itself hasn't been around that long, so durations are unknown past a certain period of time. But it looks like immunity duration might be longer with the vaccine, and we know that immunity after natural infection does seem to reduce over time. That's not clearly defined as yet, but that would be a reason to have the vaccine. I would add that the vaccine should be given 28 days after you've had COVID. You shouldn't have the vaccine at the same time. There's no point doing it all at once, for instance. But once you're 28 days past having your COVID positive test, you're then eligible to have the COVID vaccine.
Thanks, Marianne.
Okay. If my child misses the vaccination due to illness on the day when it's being done in school, will they be able to have the vaccination somewhere else, or will the school nurses make a second visit to the schools?
So I'm happy to say that. At the moment, the plan is for the school nurses to visit the school once, but that's mainly because they have a lot of schools to cover, and they need to get around all of them. There are plans being put in place for there to be mop-up clinics. For example, there will be children who are turning 12 and might be 11 on the day that they come to the school, or they might not be in for whatever reason. So they are not formalised as yet, but there will be plans for mop-up clinics to cover those children.
Okay. Although the European Medicines Regulator approved this for children, many EU governments have not followed the leads of France, Germany, and now the UK. Why are other EU countries still hesitant?
So this is not an easy question to answer, and there are many components that play into the decision of administering. Sometimes it's availability of the vaccine, sometimes it's the data available, sometimes it's the regulations for different countries, and different processes may last longer in one country than the other country. So I'm not necessarily able to comment, and I'm not sure if Sarah has any more information, but I'm not able to comment on other countries why they did not do. But as I said, USA, Canada, and Israel have done it, and I can see some questions here asking about trials and have the trials being done on this age group. So trials have been done. None of the vaccines can be approved if trials are not done on a specific age group. So trials have been done, but what you see here is also implementation of the program on a large mass scale of millions of children being vaccinated in other countries. So as children get vaccinated, all the data is collected in a slightly different way than a trial way, and all the data is looked at in order to and shared across the world in order to inform vaccination programs. So we only work on the evidence available.
Thanks, Marianne. Next question.
Is it true that the vaccine can cause issues with kidneys? And how safe is the vaccine in the long term, especially for kids with autoimmune diseases such as arthritis?
So I'm not aware of there being a specific issue with kidneys. I can't rule anything out for certain because it hasn't been around for long enough, but all we can say is the risk in comparison to getting COVID, which we know exists, and particularly for children who may have autoimmune diseases or arthritis, for instance, there are particular risks of them becoming more unwell with COVID. So it doesn't seem to be emerging from the literature that I've seen that there are specific risks in kidneys with the vaccine. Though I'm sure over time they will have a more deep dive into some of these as the numbers come through, but it's not a clear risk that is presenting itself at the moment.
Somebody asks, can a child with food allergies have the vaccine?
Yes, I can answer this one. Unless you specifically have an allergy against one of the specific ingredients in the vaccine, and there's a specific list, then you can have it even if you already have food allergies. All children who've received the vaccine will have 15 minutes of monitoring and observation just to make sure, in case any allergic reaction happened, that they're in the safest place, but they are safe to go ahead.
Okay, it's a question about the side effect, sort of rare side effect or complication of heart inflammation. Somebody wants to know what are the symptoms, if that is the case, what are the symptoms so it can be treated?
So the symptoms to look out for are chest pain, shortness of breath, or palpitations. So if your heart feels like it's fluttering or anything like that. I think, to be honest, if you were reporting chest pain, you'd probably want to seek medical attention anyway. But these are things to look out for in the first few days. And it is, as I say, treatable with, it's very unusual that you get long-term consequences. But those are the things to look out for, and do go seek medical attention urgently if you get them.
Tamara, do you want to come in as well?
Yes, I can see in a chat someone saying that children get heart attack from the vaccination. So I just wanted to explain a little bit more that we are not aware of any children having a heart attack after this vaccination across the whole world. What we're talking about is myocarditis, and I think Sarah has explained it's inflammation of the heart muscle. And usually what we have seen in not very many, very, very rare, is mild, what we call a self-limiting disease, which means it lasts a couple of weeks and it goes away on its own. And certainly with treatment, recovery is pretty much fast. So just wanted to make sure that people understand that there is a difference between those two.
Thanks, Tamara. There is a question that that's also been asked, which is whether a healthy 12 to 15-year-old is living with someone who's immunocompromised, who delivers the second vaccine. How is that arranged? Are they going to be done in school, or are they going to be done by the GP?
I'd expect that to be through primary care. There's no plan for that to run through schools. The gap should be 8 weeks between the doses. So the first dose can be given by school, and the follow-up should be through primary care.
Thanks, Sarah. Marianne, the next question, please.
Somebody asks about their 13-year-old who's asthmatic. Would they need 1 or 2 vaccines?
That would be an individual medical decision with their GP. It's only for the uncontrolled severe asthmatics that fall into the risk group who need 2 doses, but for an individual level sort of discussion of the medical needs, that would be through your GP.
Okay, next one, please, Marianne.
Somebody asks, how many children do we know that have died from COVID-19?
So I was having a look at some of the numbers earlier. I don't have all the numbers to hand, but I do know that in the UK since January, so this obviously is only the last part of the pandemic, there have been 18 deaths in those aged under 15, so up to age 4, or up to and including age 14. There have been 18 deaths in the UK since the start of this year. I don't have the other numbers off the top of my head, I'm afraid, but hopefully that's an indication that there have been some.
Okay, next question, please.
Okay, someone asking about effectiveness of the vaccine. I've been double vaccinated but still got COVID. Is the risk of getting COVID really reduced significantly with the vaccine?
So, so there is no vaccine in the world that is 100% effective. But what we do know that the COVID vaccination is highly effective against severe illness and unfortunate outcome as a death. So what we are seeing is definitely reduced transmission, but we do know that some people still do catch it, because I think when we talk about different AstraZeneca or Pfizer, effectiveness is anywhere between 80 and 95%, and effectiveness goes up in terms of severe illness and death. So so if people do catch it, it's highly likely that they would have a mild form of the illness, but it is possible still to transmit and catch it while you've been vaccinated.
Thanks, Tamara. Marianne?
Somebody else says they have a 15-year-old who turns 16 in November. Will they get a second jab when they turn 16?
So at the moment, if I understand the question correctly, at the moment, we only recommend one dose for 16 to 17-year-old. So unless the guidelines change, it's highly unlikely that they would. But we have to watch and see. And then there is another question asking as well, if child had a COVID, how long after they can have a vaccination? So it's the same rule as the adults, 28 days. We recommend, and GPs would look at 28 days before the between the being positive and vaccination delivered.
Okay, next question, Marianne.
Will children not having the jab be discriminated in any way whatsoever? For instance, will they not be allowed to partake in certain events at school?
My understanding is, in discussion with schools, that would not be the case. They would be able to participate in all activities. It is a choice whether people are vaccinated or not. Should we move on to the next question?
Next question. I think Tamara already answered about if a child's recently had the virus, is there any need for vaccination at this time? So the next question is, if some children are being offered a second vaccine because of better protection, then surely it's better to give a second jab to this whole cohort?
So I can come in here. I think everything is about a balance. It's risk versus benefit for everything that we do. And if some children have a certain underlying condition, then their risks from COVID are greater. So therefore, they benefit more from having the vaccine, and that outweighs any additional risk in having a second dose. So it's all about balancing those risks as far as we can. But for children who don't have any underlying conditions, then that risk benefit is much more marginal. And so at the moment, the advice is for one dose, because there's not the clear evidence that second dose gives you that benefit over that risk.
Thanks, Sarah. Next one, please, Marianne.
If somebody has a situation where their daughter's friend, who she was in close contact with, tested positive on a rapid test today. She has a negative test. Can she be vaccinated tomorrow?
Oh, that's a very
it's a clinical question. I suppose it would probably need a look at and confirmation by a GP. But if this was a PCR test and it was negative, that probably is fine. I don't think we recommend to people to wait for 10 days to see if they're going to develop illness. If person is feeling well, doesn't have any symptoms, and is negative, then it's absolutely fine. But always good to double check with primary care and GP before the vaccination is administered. One thing to say is that vaccination cannot be given as a prophylaxis. We have a different treatment for that. Because when it's given, it does take up to 14 days to develop immunity. So if you caught the virus, if you like, in between, and even if you had the vaccination, you could still develop illness in those times until the immunity is developed. What we have just piloted in North Central London and across the country is a treatment, if you like, where we inject antibodies, but it's what you call it on a trial basis, and it's given to people who have underlying conditions, severe underlying conditions. But that's slightly different. That's not for general public.
Thanks, Tamara. Next question, please, Maria.
Is there a greater risk for girls? I'm assuming that means from having the vaccine or rather than COVID?
I don't believe so, no. In some studies, they wondered whether there's a higher risk of myocarditis in boys, but I did just read something in the British Medical Journal this week laying some doubt under the claims that had been put forward by that recently, but I haven't seen any greater risks for girls being suggested at all. Tamara might say differently.
No, I absolutely agree. I just wanted to say, because I'm not sure what's behind that question, but we had loads of these webinars and we had loads of questions about whether vaccine impact on fertility, and this vaccine or any other vaccine has not been found to impact on infertility. Yes, it's been around for like 9 months, maybe a year, not longer than that. But if you look at the reasons why someone becomes infertile, there is absolutely no biological link, plausibility for this particular vaccination. What has been muted in different channels, in different social media channels, is that the way the vaccine was manufactured was using some sort of ingredients that would impact on infertility. So this was done in a testing phase, but it's not in the vaccine at all. It's not in any of the vaccines that are on the market. So therefore, there is absolutely no evidence that this vaccine impact on infertility. On fertility.
Okay, how does vaccinating this age group reduce transmission of the virus?
Well, as Tamara said earlier, 40% of our cases in Barnet are currently in our school age population. So if we vaccinate some of our young people, they are then less likely to catch COVID. They are less likely to transmit COVID if they do pick it up. And so that will reduce transmission within our schools. That has a knock-on effect, not only in stabilizing our education to our young people, but also they don't take it home into their homes and spread it into the community. So vaccinating this age group is really key at reducing transmission in our local community.
Okay, a couple of questions which we've already answered, so just skipping on. Also about antibodies and having the vaccines, we've talked about that already. Okay, here's a question. The JCVI specifically advised that for the vast majority of children, the COVID infection would be asymptomatic or mildly symptomatic, asymptomatic or mildly symptomatic. And that given the very low risk of serious COVID in this age group, universal vaccination was not recommended. Why then pursue this through schools?
Tamara, do you want to come in? And I think we did talk about the Chief Medical Officer's advice to ministers. So do you want to come in, or Sarah, are you going to come in?
Yeah, and I'm happy to start, and then and Sarah can pick up what I left over, what I forgot, if you like. So yes, it's true that JCVI looked at the clinical benefit only, decided there is a marginal benefit in universal vaccination, and then asked ask chief medical officers to look at the wider benefits. So what chief medical officers did, there's 4 of them in the UK, 1 in Scotland, 1 in Wales, 1 in England, and 1 in Northern Ireland, I suppose. And they've talked to Royal College of Pediatricians, they talked to psychiatrists, they talked to educational experts, and looked at all the evidence of impact of COVID on this particular age group, looking at the educational impact, educational disruption, looking at the mental health and well-being of young children, and on the basis of all of this, and also maybe also looking at the transmission of infection, that you can get in the school and bring it into the community, mixing with parents and grandparents as well. And on the basis of all of that, decided that there is a huge public health benefit to wider health and well-being of children if they are vaccinated, and the disruption to education is absolutely minimized by that. And I said before, I don't know when people joined when they asked those questions, but what we have seen is a impact on mental health and well-being of children and young people by just not being educated face to face, being at home, and being in a lockdown. It is unlikely that we might enter into another lockdown, but certainly being at home for 10 or more days and missing school, and it could happen a few times a year, is detrimental for someone's health, someone's education. And what we also have seen is that these benefits or harm, if you like, are much higher in more deprived areas where currently we have higher infection rates and lower number of people vaccinated. And not protecting this, you would widen inequalities in health, but also in educational attainment. So therefore, on the basis of all of that evidence, it was decided to introduce universal vaccination.
Okay, has there been an increase in hospital admissions for this age group?
So I don't have the numbers to hand specifically for this age group. I do know that as the pandemic has progressed and as vaccinations have been brought in, the average age of someone going to hospital and being admitted to hospital has gone down, and we now see people who are sort of middle-aged adults rather than older adults being admitted to intensive care. We've seen that with the Delta virus, the Delta variant coming through. So I don't have the numbers to hand on 12 to 15-year-olds specifically, but in general, it is more middle-aged adults rather than the older ones, because the vaccination uptake is so good in the older adults that has brought down that age.
Okay, can the child's vaccination be linked to the parents' app? It's quite a tedious process to link a child's NHS information to their parents. Can this be simplified?
I have tried that for my own benefit because I've got 3 of them, and just entering all the information when you travel somewhere, it's absolutely tedious. And unfortunately, at this moment in time, it can't be linked because it's on the individual basis. We have actually flagged that up, but we haven't had any response back as to whether app will be tweaked. I doubt it would, but it would be really pragmatic to try to do that.
Another question, because there are a few questions, but just to specifically address longer term risks, aside from the fertility issue, do we have any idea of what longer term risks there could be from the vaccine?
So obviously we haven't had the vaccine long enough to have witnessed them ourselves, but we can draw on other vaccines, and that is reassuring. You know, lots of vaccines have been around for a long time and greatly improved the health of the population. The flip side of this question is, well, what is the risk long term if you get COVID? And the issues around long COVID are still being understood, but clearly there are long-term issues around COVID. So we cannot say with any certainty. I've seen another question 5 or 10 years down the line because we've not had it for that long. But equally, it's all about a balance of risk, and the balance is against COVID, and the balance looks like you'll get much more risks with getting COVID than having the vaccine.
Okay, just skipping down a bit because I think we've covered quite a few of these other ones already.
Can I just come in? Sorry, Marianne, can I just come into that? And just to say that in most other vaccines, any side effects are usually seen either immediately or within couple of weeks. It's very rare and almost unknown that there are long-term effects of any other vaccination. And similar components are used in manufacturing these vaccinations, apart, of course, this RNA and the virus. So from that point of view, it's highly unlikely that there are any long-term complications of the vaccination itself. But what we are learning is there are long-term complications of a COVID illness itself.
Okay, so next question. When can my kid have a jab if he will only be 12 after November 2021?
So there will be mop-up clinics. So if your child is not 12 by the time that your school is visited, then there will be mop-up clinics offered. They will mainly step into gear, I believe, once the main wave of schools have been dealt with. So later on in the term this autumn.
Okay. If a child is vaccinated and gets COVID, will that child have to miss school? Also, will the bubble group have to isolate?
So if anyone gets COVID, whatever the background, they must still do their period of isolation themselves. Bubble groups shouldn't be working in the same way as they were in the summer term when most people think of bubbles. The self-isolation rules have changed so that really the majority of children will stay in school. Obviously, if case numbers change, then that might have to be reviewed in individual outbreak settings, but on the main there won't be bubble closures, and it would just be isolation for the child themselves who test positive.
What are you advising for any child that suffers from anaphylaxis?
So I'm happy to take this one. So I think hopefully I covered some of this before. It's if you have had an allergic reaction specifically to any of the ingredients for the Pfizer vaccine, then you should discuss with your healthcare provider, with your GP. If you have had allergy, even if that is anaphylaxis to something else, then you may receive the dose. I think it would make sense to mention that to the provider of the dose, but it is clear that you can have it. All children will be monitored for 15 minutes afterwards, with all the equipment and staffing necessary, so that if there were that situation, although we're not expecting it to happen, if it were to happen, you would be well supported.
Here's a question about consent. Will you invoke the Gillick competency test to undermine parents' refusal?
Thanks for that question, and it's very lively conversations across the country on that. For at the moment, what we are doing in North Central London and in Barnet is administering vaccination only to those children for whom we have a parental consent, and this is going to stay with us for 2 weeks while we are considering a process for administering vaccination for those children who are Gale competent. As with anything else, and Chris can come to this because it's got wider implications, but as with anything else, if children are deemed competent, and they have a right to request and ask for the vaccination. But what we need to ensure is that we have a proper process in place when people who are assessing the competencies and talking to children and getting consent are fully trained, and then that we offer a service which it might be in school, but it's more likely to be a referral to primary care network or elsewhere to administer that vaccination. I'm not going to comment on what does that undermine the consent of a parent, because is a right of a child, and as I started in the opening discussion, I would consent for my children, but it's my children who reassured me that they are absolutely fine to get the vaccination, and I then booked. So having that conversation with your children and understanding their point of view in a mature way is something that could help parent come to the right decision. I don't know, Chris, if you want to add.
I think you've made the point very clearly. Gillick competence is enshrined in law. It's a child over the age where they're deemed able to make a decision, a medical decision. They can make that decision. For those who aren't aware what Gillick competence is, but it needs to be considered carefully. And there needs to be a proper assessment to say that somebody can make those decisions. I think we, as Tamara said, we're using parental consent, certainly for the beginning part of this programme. And just as with Tamara, we've had some very interesting debates at home about consent and whether my children want to be vaccinated, and I hope that those conversations are happening with all of you as well. It's important that that their views are taken into account. I'm aware we've got a few minutes remaining, Marianne, so do you want to try and highlight a couple of other different questions? Because in the chat there's a lot that are raised regularly. One comment that was asked was whether we would publish the Q&A and any information that's from the questions that are in the chat. I think that would be a really good idea, that we could pull together a document from the questions that you've asked that we can publish or tweet out, if that would be of use. But I want to check that that's feasible. So I'm looking at somebody who you can't see on the screen to just check we can do that, can't we, Jonathan? Yeah, okay. So we will make sure that all of the questions that have been asked will be published with responses. Marianne, maybe 2 more questions?
Somebody asked about when it's the vaccination will actually happen at their kids' school. So I just think a general question, when is this starting to happen in schools in Barnet? Over which period is this actually happening? Would be useful.
So I'd say that oh, sorry, go ahead, Tara.
No, go ahead, and I'll add.
So vaccination started today in a school today. They'll be running from today until half term is the plan. Most schools will have one day when they are visited and try to cover all the students in that time. I don't have the timetable to hand, so I can't say for specific schools, but it's over this half term window.
And there's a question about, well, there's 2 questions here. One about, will you respect a parent's refusal? And why has age 12 and over been chosen? And are we to expect, well, it's more the second part, are we to expect any news on younger age groups in the future to be vaccinated?
So, just on a previous question, I was just trying to find information. We started booking schools just a couple of days ago, and so far we have already 30 schools booked in for vaccination. So that's a very good turnout. So we're quite pleased with that. Will we? The question was, will we undermine or will we discard parental refusal? Is that what the question was? So
it was will you respect a parent's refusal?
Will we respect parents' refusal? So as we spoke about that before, so if parents do not give consent at this moment in time, we won't vaccinate a child. But if that child equally in school talks to someone and express their concern or want to be vaccinated, in the next couple of weeks, we will have a process in place to ascertain whether they're really competent and definitely assess whether they want to get vaccinated. And I think in the law that would overrule parental refusal, if you like. But what would be better is to have a process in place, which we are discussing at the moment, is to, if this situation happens, to bring child and a parent and have a conversation together to come to a consent between a child and a parent whether to vaccinate or not. We're definitely not in there to intervene, but we have to follow the law.
Okay, and the final another one was just whether we're talking about the 12 to 15 cohort, but will there be younger children in the future who are going to be vaccinated too?
So I don't think there is discussion at this moment in time to lower the vaccination age, because it's only licensed and it's been trialed only for 12 plus, as far as I understand. So at this moment in time, I'm not aware that there are plans in place to lower the vaccination age.
Just scrolling through quickly, a lot have been answered already. Quite a few are sort of questions for your GP about whether your child is eligible for 1 or 2. So I think that's one for the. I'm just quickly sort of answering that because it's that's more of a medical question. Questions about, someone did ask whether if they don't want the child to have the vaccination in school, they can have it in a walking clinic at the weekend.
So I think the question is, can they have it in the walk-in clinic tomorrow? I think that this one, there isn't provision for paediatric vaccinations in the walk-in clinics, is there?
Not at this moment in time, but this is what we were talking about in terms of GILIC competencies. That's why we're only administering at school, and it's about the clinical governance and specific procedures being put in place. So, but we are envisaging it to be available in either walk-in clinic, well, in probably primary care networks. Our mass vaccination centers don't exist, closing this week anyway. So. So we hope there will be more alternatives other than school, but not in the next 2 weeks.
Okay, someone's trying to decide if their child should have the vaccine, but they'd like to know how many children have died from the vaccine in the US in order to help them work it out, as in places where kids of that age group have already been vaccinated.
So I think the one thing I'd like to say on this is, unfortunately, children do sometimes die. This is regardless of the vaccine. This is just out there in life. The issue is, if a child receives a vaccine and dies, was that because they would have died anyway, or is that due to the vaccine? So we need to look at how many deaths you would expect over a certain period, because some of these you'd expect to see just through normal statistics anyway. I believe there have been some deaths in children who have recently received the vaccine. I believe it was in the order of magnitude of about 10, but I don't have the specific number to hand. But the likelihood is that they may have died anyway, looking at the statistics. The full analysis hasn't been done yet. The full sort of root cause analysis hasn't been done, but there's no clear indication that any deaths have happened in young people due to the vaccine. In all cases, children had a number of underlying health conditions that are more likely to have caused their death, although investigations are ongoing, so I can't say with more certainty than that, I'm afraid.
Okay, another question. Do we know if any sixth forms in Barnet will require 16-year-olds to be vaccinated as an entry requirement in September?
They wouldn't. They won't have any requirement for that to happen. I think we've got time for one more question, Marianne.
Somebody is asking, I'm just trying to read through many questions here. Someone is asking why we aren't giving the Moderna vaccine and just Pfizer.
So I believe that Pfizer vaccine was chosen because of the risk profile for young people specifically. So they looked at the issue of myocarditis and any other risks, and the risks for this age group were lowest with this vaccine, and that underlaid the decision, as far as I'm aware.
Thanks, Sarah. I'm going to close now because I'm just aware that we've covered most of the questions, and there's only a couple of minutes left. I don't know, Tamara or Sarah, do you want to say a couple of closing words, and then I'll close the event?
Thank you, Chris. So I just wanted to say thank you all for coming. There's been at some point over 100 of you, so it signals how important this is for you, and thanks for raising your concerns. We have tried to answer what we can. We will look at all the questions, we'll look at some things that we probably maybe didn't get to answer, and write a written response. It will take us a few days to do that. This is the beginning of a conversation. We are here, and if there is a feedback that you would like more of these sessions, we are happy to do so. It's quite awkward, we can't see your faces, so we don't know whether you enjoy this session or not, but if you can provide any feedback, that would be really good for us. And just wanted to thank Jonathan, who you can't see behind the screen, and Marianne, who organized and supported this, as well as Chris and Sarah and all of you.
So thank you all very much for attending, and I hope it's been helpful, and we will endeavour to get some answers out to you as soon as we possibly can. But thank you very much for attending this evening. Bye-bye.